All right, we are putting you and your sleep first right now. We have Alice Hoagland joining us. She is a doctor with the Unity Sleep Disorder Center. Alice, why don't we just get this out of the way? What is insomnia?
Well, by definition, insomnia is difficulty getting to sleep, difficulty staying asleep, and waking up and feeling like your sleep wasn't restorative. So you really have to have that non-restorative feeling when people wake up in the morning.
Do a lot of people that you find, they just think, I just have trouble sleeping, and they don't seek the help that they perhaps need?
Probably of all of the sleep disorders that are ever sort of missed or undertreated, it's probably insomnia. A lot of people think that when you go to a sleep disorder center, you primarily go there to just have another sleep disorder treated, like sleep apnea or something like that. But actually, all sleep disorder centers should simultaneously be able to treat people who have insomnia.
Has treatment advanced over the years, or are you still using the same methods that were used decades ago?
There are some wonderful non-pharmacological advances in treatment of insomnia. As probably most of your viewers and you know, years ago we used to use medications of all kinds. Originally, decades ago, we used what were known as benzodiazepines. These were things like Valium and Ativan, that sort of thing. But then roughly 20-ish years ago, they began to develop what we call non-benzodiazepine hypnotics. That's the famous now Ambien.
Right.
Lunesta, that's the one with the butterfly that flies in and out of the windows. And another one that's called Sonata.
Okay.
Those were pushed, and there was an advancement with those because they were supposed to be non-habit forming. But we are finding that many of our patients are very habituated to these medications. It's not unusual for me to see somebody who's been on Ambien every night for 10 years, so it's a difficulty.
So interesting. I want you to stay with us because I have a follow-up on that. Plus, we want to talk about children's sleep over the summer. So, Dr. Hoagland, thank you. We will rejoin her in just a few minutes. But before we do that, we want to talk